just going to wait a couple more minutes before I get started. Thank you all for joining, those who are already here. Hello. I hope y'all are having a great Wednesday. Okay, I'm gonna go ahead and get started. Welcome to Women Wednesday. My name is Soul. My pronouns are she and they. I am one of the community health social media influencers, as well as an art educator for Whitman-Walker's New Cultural Center, the Corner, DC. And today we'll be talking about how STIs affect women. April is STD Awareness Month, and a new CDC report released last week that shows how, in 2019, reported cases of the prevalence of STDs has increased for the 6th consecutive year, reaching new all-time highs. So today we're going to be talking about how a sexually transmitted infection and disease, also called STIs and STDs, respectively, affect women. STIs can affect women differently than men. For example, each year, untreated STDs cause infertility in at least 24,000 women in the U.S. Untreated syphilis in pregnant women results in infant death in up to 40% of cases, and HPV is the leading cause of cervical cancer. So today, we're only going to take a look at just a few STIs, gonorrhea, chlamydia, and HPV. So feel free to drop some questions and thoughts in the comment sections and let us know if you want to hear more about STIs and how they affect women. Gonorrhea. Gonorrhea is a bacterial STI. It's estimated that around 1 million women are currently infected with gonorrhea. Contrary to popular belief, gonorrhea cannot be transmitted from toilet seats or door handles. It can't live outside the body for longer than a few minutes, nor can it live on the skin of the hands, arms, or legs. It survives only on moist surfaces within the body, and that's why it's often spread through sexual contact. Gonorrhea is found most commonly in the vagina, the cervix, and the urethra, as well as the back of the throat from oral genital contact and in the rectum. A majority of infected women have no symptoms, especially in the early stages of the infection. When women do experience signs and symptoms of gonorrhea, they include burning during urination, frequent urination, a yellowish vaginal discharge, redness, and swelling of the genitals, and vaginal itching or burning. If untreated, gonorrhea can lead to a severe pelvic infection with inflammation of the fallopian tubes and ovaries. Gonorrhea can also spread through the body to infect joints to cause gonococcal arthritis. Gonorrheal infection in the fallopian tubes can also lead to a serious, painful infection of the pelvis known as a pelvic inflammatory disease, or PID. PID occurs in a significant portion of women with gonorrheal infection of the uterine cervix. Symptoms of pelvic infection include fever, pelvic cramping, abdominal pain, or pain with intercourse. Pelvic infection can lead to difficulty in becoming pregnant or even sterility. But the good news is that testing and treatment is really easy. So just go to a free STI clinic like the one at Whitman-Walker and get throat or rectal swabs and a urine sample. If you test positive, you'll meet with the medical provider to get antibiotics and you're cured. Chlamydia. Chlamydia shares a lot in common with gonorrhea. It's also a common bacterial infection, actually more common than gonorrhea, with more than 1 million women estimated to be currently infected. It's transmitted through sexual contact and can be found in the most commonly it can be found most commonly in the vagina, cervix, and urethra, as well as the back of the throat from oral genital contact, and in the rectum. Like with gonorrhea, the majority of women with chlamydia do not have symptoms. Cervicitis, which is the infection of the uterine cervix, is the most common presentation in the clinic. While about half of women with chlamydial cervicitis have no symptoms, others may experience vaginal discharge or abdominal pain. Infection of the urethra is often associated with chlamydial infection of the cervix. Women with the infection of the urethra have the typical symptoms of a urinary tract infections, including pain upon urination and the frequent and urgent need to urinate. Again, like gonorrhea, please excuse me, y'all. Again, like gonorrhea, chlamydia is very destructive to the fallopian tubes. It can also cause severe pelvic infection. If untreated, some women with chlamydia will develop pelvic inflammatory disease. Because it is common for infected women to have no symptoms, chlamydial infection is often untreated and results in extensive destruction of the fallopian tubes, fertility problems, and tubal pregnancy. Chlamydial infection is also associated with premature births, and in addition, the infant can acquire the infection during passage through the infected birth canal, leading to serious eye damage or pneumonia, and that's why all newborns are treated with eye drops containing an antibiotic that kills chlamydia. Treatment of all newborns is routine because of the large number of infected women without symptoms and the dire consequences of chlamydial eye infection to the newborn. The good news, again, is that testing and treatment for chlamydia is really easy. Just go to a free STI clinic, again, like the one at Whitman-Walker, and get throat and rectal swabs and a urine sample. If you test positive, you meet with a medical provider to get antibiotics, and you're cured. The human papillomavirus, aka HPV, is very different from gonorrhea and chlamydia. It's much more common, in fact. HPV infection is considered to be the most common sexually transmitted infection in the U.S., and it is believed that a majority of the reproductive age population has been infected with sexually transmitted HPV at some point in life. HPV causes genital warts that are primarily transmitted during sexual contact. In addition to warts, HPV infection has long been known to be the cause of cervical cancer and other anogenital cancers in women. HPV infection is common and does not usually lead to the development of warts, cancers, or specific symptoms. In fact, the majority of people infected with HPV have no symptoms or lesions at all, but asymptomatic people, i.e. those without HPV-induced warts or lesions, who have HPV infections are still able to spread the infections to others through sexual contact. A typical appearance of a genital lesion may prompt the physician to treat without further testing, especially in someone who has had prior outbreaks of genital warts. Genital warts usually appear as small, fleshy, raised bumps, but they can sometimes be extensive and have like a cauliflower-like experience. They may occur on any sexually exposed area. In many cases, genital warts do not cause any symptoms, but they are sometimes associated with itching, burning, or tenderness. HPV can sometimes be suspected by changes that appear on a pap smear, although pap smears were not really designed to detect HPV. So in the case of an abnormal pap smear, the clinician will often do advanced testing on the material to determine if and which kind of HPV may be present. HPV can also be detected if a biopsy, for example, from a genital wart or the uterine cervix, is sent to the laboratory for analysis. There is no cure or treatment that can eradicate the HPV infection, so the only treatment is to remove the lesions caused by the virus. Unfortunately, even the removal of warts does not necessarily prevent the spread of the virus, and genital warts frequently reoccur. But people with warts can get a gel that prevents outbreaks and decreases symptoms. So let's talk a little bit about prevention. There are a few ways that you can stop the spread of STDs and STIs. And here are a few of them. Use condoms when you have sex. Condoms prevent against the transmission of gonorrhea, chlamydia, and syphilis, and they're really effective when used correctly. Make sure that you're getting tested. If you know that you're negative, you can't spread anything to your sexual partners. And if you happen to be positive, you can get treated easily so that you don't spread any infections to your sexual partners. Going along with that, make sure that your partners are getting tested. Use the same logic. If your partners get tested and their results come back negative, they can't give you anything. If your partners get tested and their results come back positive, they can easily get treated so that they don't spread any infections to you. Consider having a mutually monogamous relationship. That way, you and your partner only need to get tested once. As long as you're each other's only sex partners, you can't get an STD. Educate others about STDs and their spread. So many people don't know this information, and you can help your friends, neighbors, and community by sharing this information. You can also choose not to have sex at all. This can be difficult for some people, but others find comfort in having themselves as their only sex partner, and get vaccinated if possible. Gonorrhea and chlamydia don't have vaccines, but HPV has a very effective one. Talk to your medical provider to see if you qualify, as a vaccine is typically only offered to those between the ages of 9 and 26. What's a little scary about many STDs is that they're asymptomatic, meaning you can't tell if you have them, but some of them can harm. Very smooth. Okay. But some of them can harm your health, even if you don't have symptoms, and you can always spread them to others. If you're not sure of your status or you just want to get it checked to be sure, Whitman-Walker Health offers free HIV and STI testing at our Liz location in Northwest D.C. and at our Max Robinson Center location in Southeast D.C. You can make an appointment by calling 202-797-4439. The number is pinned. Are there any questions? As I wrap up, I do want to remind people about. I'll just remind you all about sex and another virus, COVID-19. As we know, COVID-19 is a virus that can spread when you're within 6 feet of a person with COVID-19 who coughs or sneezes. So if you get near someone, like when you're getting intimate, you're putting yourself at risk. So make sure that you are staying at least 6 feet away from other people when possible, wearing a mask in public, avoiding places with large crowds, encouraging work from home if possible, speaking with loved ones on the phone or over FaceTime instead of in person, social distancing as caring for community, stay up to date on local, state, and national guidelines for testing, quarantine, and general safety, washing your hands for at least 20 seconds at a time, staying home if you don't feel well. Everyone in the U.S. is eligible to get their COVID-19 vaccine now, so if that's something that you're interested in, make sure that you're signing up. You can visit your jurisdiction's website to register. When it comes to having sex, you are your safest sex partner. Masturbation will not spread COVID-19, especially if you wash your hands and any sex toys with soap and water for at least 20 seconds before and after sex. You can follow Whitman-Walker on Twitter, Facebook, and IG at Whitman-Walker and at RealTalk_DC and at The Corners DC to stay up to date with all things Whitman-Walker Health. The Corner will be opening a new exhibition next week on Friday, April 30th, called Stay Alive to Life, Resilience in the Times of COVID. So be sure to be on the lookout for any information surrounding that. Till next time.